Once again, here are Dr. Bonati and your host, Kimberly Brumell.
Thanks for listening to American Medicine Today. I'm Kimberly Brumell, joined by world-renowned orthopedic surgeon, Dr. Alfred Bonati. We have Aaron Jacobson here, along with our senior fellow, Jeff Wagstaff. On the line, we have Dr. Randall Latore, top Tampa otolaryngologist, and he's here to talk about a balloon technology for treating chronic sinusitis, which seems to be affecting over 35 million Americans with pain and pressure. Why don't you tell us more about that, Dr. Randall, or Dr. Latore?
Really?
Yes.
The procedure is an in-office procedure, actually, and it came about originally back in 2008 when I was doing it in the operating room, and found that this was a technique we could bring into the office, which actually makes it more, let's say, pleasant and a lot better experience for the patient. And it does the same thing as we would perform in traditional sinus surgery, which would be in the operating room.
Dr. Latore is somebody who has suffered from just terrible sinuses since I was a kid. Tell us some of the symptoms that are necessary or that you find appropriate for this procedure.
The patients typically will present with a history of recurrent sinus infections, and the symptoms usually are nasal congestion, postnasal drip, maybe a yellow or green color to the nasal discharge, coughing, sore throat, facial pain and pressure, and headaches. And those are really the types of symptoms I look for in the patients that are coming to see me. And also I use their CAT scan of their sinuses to really seal the deal to tell them they would be a candidate.
It seems like so many of us who get sinus infections, it seems like if you get one, almost every time you get a cold, you end up with a sinus infection. Do you find that in your practice?
You know, it's interesting. It's interesting that you say that because a lot of us will first develop what's called an upper respiratory tract viral infection. And typically, the symptoms are very similar to that of sinusitis, except that the drainage is usually clear. But then you get the inflammation, which causes what I call a shutdown of the sinus, and then you get the mucus buildup. The bacteria then can infect that mucus, and then that's when you have the change in color to green, yellow, or even brown. And now they need antibiotics at that time.
Dr. Latore, that's what my personal physician said. He said, look, when you get a cold, as long as you have that clear discharge, you have a cold. As soon as you see coloration to that, that tells me that you probably have an infection and you need to get in to see me right away. Is that a fair rule of thumb?
Absolutely. And that's what I try to tell a lot of the patients. You know, the patients, everybody seems to want an antibiotic. And the issue is not everybody needs an antibiotic. We just need to let the upper respiratory tract viral infection run its course. But when it does change color, it's very important to get to your primary care or an otolaryngologist, which is an ear, nose, and throat physician.
Dr. Latore, is so frequent in Florida, preferably in this time on springtime or autumn time, that people develop so much this type of a problem due to an allergy. And these allergic reactions complicate all this. And I am very interested in knowing in a little more information for the patients how this procedure works. I understand that you put the balloon inside and how that works. Will you explain us a little bit?
Well, what I'm doing now is the patient would come into the office, and we spend a lot of time topically anesthetizing the nose, preparing it for the procedure. And similar to the catheters that you see in cardiology, we have a disposable balloon that actually I can reach the opening of the sinuses and then inflate the balloon, and it will cause what we call a microfracture of the bone in a wider position. And it does not shrink. Once I deflate the balloon, I remove the balloon, and that opening stays permanent. And the best thing about this procedure is it causes less trauma, less bleeding, and therefore faster healing.
Well, if I try to put in my mind what you're saying, and just for the public, really in the area of the sinus, you have some type of a cancellous bone. That means it's a soft bone. So when you put the balloon there and you put that pressure, what you do is you increase the size of that sinus. So and also you probably increase the area of drainage. Is that correct?
Absolutely. My goal with the procedure is to use the balloon, which inflates to a much larger diameter than the actual opening that all of us have. And once that's completed, it allows for a larger window, so to speak, for the sinus to drain and also have air go in and out.
Now, how long is the balloon actually in the nose for?
Typically, during a balloon of the opening, it's about 7 seconds.
Okay.
Wow.
And once you
Very
remove
quick.
the balloon, how long these patients are going to have some discomfort or some pain? I'm trying to put this thing, asking you questions more like a patient, not like a doctor. So
Sure.
they imagine that I go and you put the balloon and I go, how much it's going to hurt and what's the consequence of this pain, how long I'm going to hurt, and what type of a drainage, for how long is this going to drainage, and how I will know if I'm better or not.
Well, we give our patients a little bit of by-mouth medicine to make them a little more calm and feel a little bit more comfortable so they're not as anxious. When I inflate the balloon, the patients are awake, and I will talk to them through the whole procedure, and I'll let them know you're going to feel some pressure. It may be a little bit of discomfort. As I inflate the balloon, 7 seconds, I take the balloon down, and the pressure typically disappears once the balloon is deflated. Then I move on to the next sinus, and typically I will balloon 6 sinuses in a patient. The healing process obviously takes some time, so the patients will begin to feel much better, usually within 3 to 4 days. They'll start to see a little bit more drainage. Why? Because the sinus is more open and allowing drainage to occur. And really full healing, probably about 4 weeks with minimal discomfort.
Dr.
So an example, yes.
One of the major complaints of patients with sinusitis is not only the fact that they have a purulent type of a drainage, but the major problem is that they have a headache and a pain in between the eyes that is very, very bad. So is this treatment remove that pain immediately, or you wait for a little bit?
I think that depends on the patient. I have had several patients where I perform it on a Friday, their headaches are gone by Saturday. Then I have others that their headaches may take a week to sort of dissipate based on the inflammation. But the majority of my patients find that headache relief between the eyes, behind the forehead, and the cheek area, that it resolves within 5 to 7 days of the procedure.
Wow. How long are you working with this procedure that you invented?
Well, this is not something I invented. This is something that I began using in 2005 in the operating room and went through several iterations of the balloon with the company, and then finally decided that this is something that should be brought into the office really for the betterment of the patient. It's less discomfort, faster healing time, less trauma, and we don't use any packing.
That's fantastic. One new advance in medicine created by the ingenuity of the physicians in this country. Thank you very much, Dr. Latorre.
I have a quick
you.
question. You know, being a female, if I was going to go in for this sort of procedure, would you have bruising afterwards? What types of things happen to you after the procedure? I mean, obviously you have a great effect. Now you can breathe and you're not going to have that sort of problem, but could you go right back to work? Are you going to have bruising, or are you going to be, I guess, having any physical issues after that?
Well, there will be no bruising.
Okay.
There will be no swelling of the face. So you will look like you've had nothing done. And essentially, all the work is done internally through the nose or the nostrils, the openings.
Okay.
So you will be congested, and you will have a little bit of dripping from the nose. And the only thing I send my patients home with is a little nose dressing that they may have to change periodically the first 2 days.
Okay.
But typically, they have really discomfort, and I'm a conservative physician, so I don't like my patients to begin strenuous activity. So I usually say take the weekend, relax, no strenuous or physical activity. Monday you can go to work, and you can actually start slowly introducing regular activity at that point.
So it sounds like a day or two of short-term discomfort for a lifetime of relief.
Yes, and this has really taken what we do as ear, nose, and throat surgeons to the next level. Nobody really wants to have surgery done. They don't want general anesthetic. They don't want to be packed. They want something that gives them quick relief with little downtime. And I think it's a perfect procedure that we can offer our patients now, and very successfully.
Well,
Unbelievable.
Yeah, with 98% success. That's what it says here. That's incredible. Dr. Bonati, continue.
Well, what I see is that a lot of people that they suffer of these sinusitis problems, they go with headaches for a long, long time. They take anti-inflammatories, they take pain medication. They are practically slaves of this pain. The situation is that if you do that, then with this treatment, you can even treat people earlier, and the results are advanced, faster, and incredible. Thank you again.
Thank you for being
Absolutely.
here, Dr.
Thank you.
Latore. If you
I
come up
appreciate
with
it. Thank you very much.
Take care. You are listening to American Medicine Today on News Radio 970 WFLA. We are going to be telling what's new in American medicine today coming up after the break. But if you or someone you know is suffering with headaches, back, neck, or sciatic pain, reach out at 855-267-0482 to the Bonati Spine Institute or Bonati.com. You're listening to News Radio 970 WFLA.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
The Bonati Spine Institute is proud to announce more than a 94% patient-reported success rate in over 45,000 patent-protected spine surgical procedures. Call us today at 855-267-0483 or visit us at Bonati.com.
All my pain is gone. Today I am totally pain-free. Nothing. No after effect.
I'm pain-free, and I have had to take any pain medication.
Today I am pain-free for the first time in over a year, and it is so awesome.
I only wish I'd known about it earlier. Right now, I am completely without pain.
Sitting here in this office right now, pain-free, eager to enjoy the rest of my life.
I am feeling great.
I feel 100% better, like a new person.
Today I feel absolutely fantastic. It's just incredible, the relief I feel right now.
Today I'm completely pain-free.
During the procedure, I literally felt the pain melt away. It was fantastic.
I feel so good.
It took care of my headaches instantly.
It's incredible. It's really incredible.
It gave me my life back.
It's just wonderful.
I feel fantastic.
It is just absolutely amazing.
So I'm hoping to be climbing hills in a few weeks.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.